Hi, I'm Dr. Cristina Castillo-Nelson. I'm family practice with obstetrics at Grande Itasca Clinic and Hospital. Prenatal care is health care for both mom and baby throughout the whole pregnancy, including all 3 trimesters. So prenatal care usually starts right when somebody has their first pregnancy positive test at home. You want to call your provider, call the clinic, and set up an appointment as soon as you find out that you're pregnant. The first couple visits with your provider are really important to get your dating accurate. So we'll do a confirmation pregnancy test right at the beginning, and then we usually order a first trimester ultrasound by about 8 weeks. And then we also go over medications that are safe in pregnancy. We talk about prenatal vitamins. We talk about things to avoid in pregnancy like alcohol and drug use. We also, in that first couple of visits, talk about healthy weight, lifestyle modifications, and then comfort too. Nausea is a really common symptom early on in pregnancy, so is constipation. So we talk about ways to help those early symptoms. So seeking prenatal care right away when you find out you're pregnant is really important, not only so you can start prenatal vitamins right away, because that helps with baby's organ formation. It's really important in baby's health and growth and development, but also we can see if there's any medications that you're taking that could be affecting baby one way or another. And also, we can find out the dating of the pregnancy, which is important for issues later on. Prenatal care is organized in the first 2 trimesters, so weeks from 1 to 28. We have prenatal visits every month, and that will look like monitoring for moms and for babies. So we always measure growth of the baby, we listen to baby's heart rate, make sure those are normal, and we'll always measure mom's blood pressure and weight to make sure that those are progressing normally. And then in the 3rd trimester, then we start to do visits every 2 weeks from about weeks 28 to 32. And then in the last trimester, we have visits every week. And that's to monitor for signs of labor and measure also blood pressure and weight and talk about any potential screenings. We always look for things like preeclampsia and blood pressure elevations. So in every prenatal visit, we always start with the mom's symptoms first and make sure that if there's any nausea or vomiting in the first trimester, we're addressing that. If there's any signs of labor, we're addressing that too. And then the next part is focused on kind of the vital signs, blood pressure and things like that, and then medications we talk about. We do lab monitoring as well, so we do blood work and urine depending on the trimester. The first OB visit is really important. We do a lot of blood work and we screen for things like anemia. We talk about genetic testing that's recommended and offered in pregnancy. And then towards the 2nd trimester, we screen for things like gestational diabetes and anemia again. We also test for STDs or sexually transmitted diseases that could affect the pregnancy. So ultrasound's a big component of prenatal care. So we usually get an ultrasound around the first trimester, around weeks 8 or 9, and that helps us to confirm that there's a pregnancy. It tells us if there's one or more. It helps us look at things like the placenta as well. And then at 20 weeks, we usually offer a 20-week anatomy scan, and that looks at all the organs of the baby and helps us identify any potential issues at that point. And also a lot of people want to find out the sex of the baby, boy or girl. Some patients do require more often imaging depending on their risk factors and depending on the development of the baby. For example, if we have a baby who's measuring a little bit smaller or a little bit bigger in that 3rd trimester, we'll get more frequent imaging just to monitor growth more carefully. Grande Itasca Clinic and Hospital, your health is our specialty.